So good morning, good afternoon, and good evening, everybody. And thank you to the Miller Center, the Reform for Resilient Commission, and Harvard Cheng School of Public Health, and the European University Institute for the opportunity to be here with you today. Now, it is an honor to be speaking today as a representative of a company that has dedicated significant resource to changing the course of the pandemic with a vaccine, what we call made for the world, driven by broad and equitable global access. Today, I will be primarily focusing on AstraZeneca's learning from the manufacturing and distribution of vaccine supply. In April 2020, we formed a landmark partnership with the University of Oxford for the global development, production, and supply of a vaccine for COVID-19. We committed to doing this for as many countries as possible and no profit during the pandemic period. We at AstraZeneca believe that none of us are safe until all of us are safe. And you heard this consistent theme from the professors that spoke before me. Since then, and to date, more than 1.7 billion doses of our vaccine have been released for supply to more than 170 countries. And approximately 2/3 of these doses have been delivered to low and lower middle income countries, where the need for life-saving intervention is greatest. Now, when we looked at the September data, there were about 585 million individuals who had received at least one dose of our vaccine, which means over 105,000 deaths and over 620,000 hospitalizations worldwide have been prevented. So imagine the power of all of the vaccine available globally. Now, in clinical trials, our vaccine has demonstrated 100% efficacy against severe disease and hospitalization after 2 doses. And real-world evidence shows the vaccine is around 80 to 90% effective against severe disease due to World Health Organization identified variants of concerns, including the Delta variant. Now, through incredible commitment and hard work of so many within AstraZeneca and our partners, we launched a rapid worldwide response to manufacturing. We were racing with time to accelerate vaccine production and supply. We have established manufacturing capacity in 15 countries across 25 different sites. We work together with international partners and health authorities of almost every Asian country to identify manufacturing capacity that will be large and advanced enough to support the in-region supply. Now, we established manufacturing partnerships in Japan, and Korea, and Thailand, India, Australia, and China. Asia Pacific has become home to one of the highest concentrations of manufacturing sites worldwide for our vaccine, with our Asia Pacific sites now producing well over 200 million doses a month. The setting up of a global supply network, along with technology transfers and qualifications, is a huge undertaking that normally takes years. It was instead achieved over a period of 8 months. Now, I've been in the industry for 30 years, never seen this before, never thought it was possible. But it demonstrates the ability to change the face of global vaccine manufacturing with the right degree of collaboration, innovation, and selfless commitment from so many. A high level of collaboration is also required for the export of raw materials and consumables. It is critical that international suppliers and governments come together to ensure a constant supply of materials and components. More than once, our supply to immunization programs across Asia has been interrupted due to export restrictions and global material shortage. So a robust pharmaceutical supply chain must be a critical component as we plan for the next pandemic. Now, AstraZeneca took a very different approach to access. To deliver a vaccine for the world meant we needed a truly global supply network. It also meant we needed our vaccine to be affordable from the outset to the poorest of countries alongside the richest of countries. Access to our vaccine via COVAX facility has been a key part of our distribution strategy. As the first global pharmaceutical company to have joined COVAX in actually June of 2020, we are proud of the progress that have been made so far. Approaching 1/2 of all doses supplied to COVAX globally have come from AstraZeneca. For many Asian countries, these were the first COVID-19 vaccines they received, providing critical protection for frontline workers and the most vulnerable. Now, with COVAX supply capped at 20% of the population, we provided additional supply directly to the governments. Many of them faced significant hurdles at the beginning of the pandemic to create the required legislations and release funding to procure the vaccines, which slowed down the rollout of the vaccine in Asia. Now, in 2021, we have likely seen the largest global immunization campaign ever. But the waning production of vaccines puts booster strategies high on the public health agenda. The WHO group of experts recommends a third dose for the immunocompromised and the elderly, but also calls for the urgent boosting of all adults vaccinated with some of the lesser effective vaccines. We will also know in time, as more data becomes available, what the appropriate long-term vaccine boosting approach should be like for all vaccines. Now, in response to the variants whose spike protein differs most significantly from the original strain, such as the beta variant, we are developing a modified vaccine that provides additional protection against a mutation. This could prove critical if, for instance, the Delta Plus variant, which carries the mutation, becomes more prevalent. Now, R&D and manufacturing support from the United Kingdom, real-world evidence from Korea, as well as regulatory support from the TGA in Australia have made a significant impact in the availability and distribution of our vaccine in Asia. Amidst the scientific and medical certainty of the pandemic, financial and scientific support from the world's strongest economy remains very, very crucial. So our most significant learning has been the need for a global mindset from the outset. The rate of vaccination that we have delivered to the Asia Pacific region would not have been possible without the regional and local manufacturing and a pricing model that put our vaccine within reach of the low-income countries. Ending the pandemic is going to continue to rely on localized approach in every region in a continuous commitment to affordability and donations. Now, in closing, I know we are at time, I leave you with 5 key points. 1, none of us are safe until all of us are safe. 2, global pandemic requires worldwide response to manufacturing. Number 3, AstraZeneca took a very different approach to access to ensure broad and equitable access to our vaccine at no profit during the pandemic, and we really hope more will follow suit. Number 4, we have a robust approach to the next phase of the pandemic, but a concerted effort globally is needed. And number 5, our most significant learning has been the need for a global mindset from the outset. So once again, thank you to the Miller Center and everyone's support for making this event possible. Thank you and be well.